AJ Gokachia, our NACO representative, Dagny Stapleton, my directors, Michael Brown and Terry Reynolds, and all those who worked with them day after day to develop sector-specific guidance that you'll see in great detail later on our website as it deals with specific industries and sectors of our community. I'm able to move up this announcement because as a state, we have met our gateway benchmarks for starting our reopening, the ones that I laid out 2 weeks ago and are included in our roadmap to recovery. Our reopening criteria were very specific. We're looking for consistent and sustainable downward trajectory in the percentage of COVID-19 cases and a decrease in the trend of COVID-19 hospitalizations over the 14-day period. Our cumulative test positivity rate reached 12.2% on April 24th and has since decreased to 11.2% as of yesterday. The entire total has gone down a full percentage point, which is a significant decrease. And when it comes to confirmed COVID hospitalizations, we see an overall decreasing trend since April 21st, a total of more than 14 days on a downward trajectory in hospitalizations and intensive care hospitalizations. The trend is strong enough to meet the consistent and sustained criteria for moving into phase 1. Secondly, our healthcare system needed to move out of the crisis mode that they were in and be prepared to handle potential surges in patients. According to the Nevada Hospital Association, hospitals have enough capacity to manage a surge currently. We will continue working with them to ensure that they are prepared and continue to stay prepared for any potential surges. To date, we have distributed nearly 3 million N95 and surgical masks, and we are rebuilding our PPE stockpile to be able to continue distributing items. We'll continue to place orders and distribute items, and I want to thank our task force, our private task force that did so much in terms of raising funds, ordering these materials, getting them in the warehouses, and our Nevada National Guard, who've done an incredible job of distributing them, not just to our hospitals, to our hospital agencies, to our nursing homes, to our veterans' homes, all the places that they were necessary. The Guard has been instrumental in making this day a reality. Thirdly, I want to make sure that we've had expanded our testing capacity. You know that's something I talked about regularly, our testing capacity, and to have sufficient lab capacity to process those tests. We met this benchmark last week and are able to test symptomatic patients. And just this week, the state DHHS sent out a bulletin expanding testing to include asymptomatic patients, which is a significant progress for us, so that they will all be able to get tests now if they've been identified as either symptomatic or asymptomatic patient. We are continuing to move towards our goal of 4,000 tests per day. You've probably seen reports around the state of these pop-up testing sites that are coming into place, testing at specific businesses. We're encouraged by that. It's definitely increased our testing collection abilities, and our labs have the capacity to do more testing now developing, and we're confident that we will be able to reach that benchmark of 4,000 tests. Fourth, we must assure that our healthcare workforce, locally and throughout the state, follow up on our expanded testing through a significant contact tracing to track down any clusters, isolate and minimize future cases, and potential outbreaks. The state continues to work with our local health districts and their counties to scale up their contact tracing resources and capabilities throughout phase 1. It's extremely important that when we identify a positive, we can follow up with who that person is at contact with, do the tracing, and eliminate a surge in any cases. Finally, we want to make sure that we have a sustained ability to protect our most vulnerable populations and minimize outbreaks in special settings. One outbreak, just one outbreak among our vulnerable populations is too many. But Nevada will continue to respond aggressively to these outbreaks and identify any resources needed to expand the efforts and tap down any outbreaks that could potentially come about. Now I want to talk about some reopening businesses that are allowed with social distance requirements, spacing, hygiene, and wearing of masks. I'll begin with several, and I know that you've got specific businesses you're all probably interested. I'm going to begin with restaurants. We still encourage curbside pickup, or delivery, but restaurants can now open for dine-in under these requirements. They must require, I repeat, they must require employees to wear face coverings and encourage customers to wear face coverings. In-person dining will be limited to no more than 50% of the available seating capacity, excluding any bar seating. Reservations should be required. Tables or booths must be spaced 6 feet apart. Bar tops and bar areas within restaurants will remain closed for the current time. If someone is waiting to be seated, the person must wait, or the patron or the party must wait outside of the establishment, in their car, on the sidewalk, in an area outside the actual confines of the restaurant, while they're waiting for their reservation to come forward. This also goes for pubs, wineries, bars, and breweries that serve food in a restaurant-type setting. So to be perfectly clear, if the bar is serving food, they can open and have food served, but the bar area itself cannot be opened up. A standalone bar that does not serve food cannot open under Phase 1. The next area that I've probably gotten more inquiries on, including some of my own family members, deal with barbershops, hair salons, and nail salons. They may open under strict social distancing requirements, and I'm going to get into that. If there are partitions or walls between the workstations or the chairs, we strongly encourage those to be there. If they are not there, then the business must use only every other chair or station to ensure that they are 6 feet apart. We must respond and maintain the 6-foot social distancing. So if there's not a partition in between the stations or the chairs, they have to make sure that there are 6 feet in between two stations. Services must be provided through appointments only. No walk-ins will be allowed, and you will have one customer per stylist or cosmetologist. Stylists, beauticians, barbers, and all staff must wear face coverings and encourage their clients to wear face coverings. Moving on to retail businesses. Retail businesses are strongly encouraged to promote and continue their online or call-in ordering, curbside pickup, delivery, and operations, but they now may reopen under strict social distancing requirements. Retail businesses shall limit the number of customers in their facility at any given time to no more than 50% of the allowed occupancy based on applicable fire codes. This is going to be a change for some of our businesses that are currently open, the big box stores and grocery stores and department stores that have not been subjected to the 50%. They now can have no more than 50% of their occupancy in a store at a time. So they're going to reduce the capacity in those grocery stores and big box stores that have been operating without that. Malls. Open-air malls may open in accordance with the retail business standards that I previously mentioned. Indoor malls remain closed to the public, but they may establish an outdoor curbside pickup or delivery operation to the extent practicable following strict social distancing requirements. What I mean by that is if it's an indoor mall and someone can order a dress or a shirt or shoes or whatever it might be and have it delivered to the curbside, that is allowable, but the customers are not allowed inside of the mall or inside of the store. Automobile, ATV, and recreational vehicle dealers. We encourage appointment only. Test drives are allowed if only the customer or customer household members are allowed in the vehicle. No dealership representative in the vehicle with the customer on a test drive. Showroom areas open to the public must not exceed 50% of the allowed occupancy based on applicable fire codes. So whatever the fire code allows, it has to be less than 50% of that for those dealerships and their showrooms. To summarize this briefly, if you're a retail business, you may open, but you have to follow these rules and review the forthcoming business and sector-specific guidance that the LEAP and the state have drafted and will be available on our website after this press conference later today. All retail businesses, regardless as to whether they were previously defined as essential or non-essential in the previous directives, must abide by the Phase 1 statewide standards for retail businesses. Again, I'm getting back to the fact that the businesses that were previously open that did not have capacity restrictions placed upon them now do have capacity restrictions placed upon them, and we will reduce the density in the big box stores and the grocery stores, as I say, to 50% of the fire allowed capacity. Businesses also must adopt measures put forth by OSHA to help minimize the spread of COVID-19. Retail cannabis dispensaries are encouraged to continue curbside delivery and pickup operations, but may now conduct in-store sales only after submitting a plan and receiving approval from the Marijuana Enforcement Division. There is more information on this as well on the cannabis stores on our guidance documents, which will be on the website. Face masks. I cannot stress strongly enough the importance of having a face mask, face covering, and wearing it regularly. Face coverings and masks are strongly encouraged for everyone in public. All employers and businesses, to repeat, all employers and businesses shall require employees to wear strict guidance, to adhere to strict guidance of wearing face masks, especially those that have face-to-face interaction with the customers. So any employee in any of these businesses that are now allowed to open are required to wear a face mask in the public. During phase one, we are also encouraging individuals to stay home unless you need to leave for essential activities. And all large public gatherings or gatherings over 10 are still prohibited. Unfortunately, you're all aware that Sunday is Mother's Day. Like Easter, it cannot be celebrated with large gatherings of people from multiple households. No one would love better than to have a Sunday Mother's Day dinner with their mother, their 93-year-old mother, than me. But this is not the time to do that. I love my mom too much to have dinner with her on Sunday. We can FaceTime together. I think she knows how to do it, I don't. But we can have a phone call, but we encourage you not to have those dinners, those interactions with your family members. No good can come from that. The satisfaction of having a brief conversation over a ham dinner or whatever it might be is not worth taking the chance of having your loved ones contract COVID-19 and suffer. Please celebrate with your loved ones by protecting them from COVID-19. Vulnerable populations. I know we're all concerned about our vulnerable populations. If you are a member of a vulnerable population, you must continue to shelter in place. You can become a vulnerable member based on many things, based on your age, based on previous medical conditions, whatever that might be. Members of households with vulnerable residents should be aware that by returning to work, those folks that are now going to be returning to work in a retail or a salon setting or whatever that might be, you have to take new precautions when you come back home if you've got a vulnerable population member living with you. Please, you can carry the virus back home. That's why you have to take the precautions at work and take extra precautions when you get home. Additional best practices and information for businesses and individuals are featured in the statewide phase one guidance that will be released shortly, from ways we can best protect our vulnerable populations to the guidance that we need to continue avoiding non-essential travel. Now, for the ones that are going to be a little disappointed, I'm going to name some businesses and sectors that will not be reopening as part of phase one. They include bars, nightclubs, taverns that are not currently serving and do not have a license to serve food. Gyms and fitness facilities, including yoga and spin facilities, Pilates, dance and bar, and all the other things that were brought before me, will not be allowed in phase one. Entertainment and recreation activities, such as, and I'm not going to get every one here, so I hope people can look online and use some common sense, but some such as bowling alleys, movie theaters, with the exception of drive-ins, and the drive-ins are allowed, live venues, sporting event venues, arcades, recreation, and community centers will not be allowed to reopen under phase one. Strip clubs and brothels will not be opening under phase one. Spas, tanning salons, massage parlors, body art, and body piercing establishments will also not be opening under phase one. And as a reminder, gaming establishments will not reopen in phase one. Gaming operations shall remain closed until the Gaming Control Board determines that operations may safely resume. I want to be clear. If you are not a business that must remain closed, the ones that I spoke of just previously, you may reopen this Saturday at 12:01 a.m. following the strict social distancing guidelines and the guidance laid out by the LEAP. Stay safe to stay open. I know many Nevadans have worked hard to get us to the good place we are today, and I thank you so much for doing that and for understanding the magnitude of the crisis that we are facing and for taking the necessary precautions, even though they were difficult, changes in our everyday routine to protect not just yourselves, but to protect your loved ones. We could not have gotten this far without the help and cooperation of all Nevadans that participated by practicing the social distancing guidelines, by wearing a face covering, by limiting your groups to under 10, by doing what was the right things. And I want to emphasize we are not done with this fight. We can't put our gloves down now. The beginning of our reopening of our economy is not the end of the coronavirus. Because we're moving into a phased-in approach to phase one here, the coronavirus is still with us as strong as ever. It will not go away until there's a vaccine. And we don't have any vaccine in the foreseeable future. So our actions are going to demand that it demands that our actions remain vigilant and strong in terms of practicing our guidelines and social distancing, and we continue to move forward with our reopening. If we want to stay open, it's on us to continue to social distancing measures that allowed us to get to this point. If we have more patients, we will have less patients in the hospital. More patients on our behalf will mean less patients in our emergency rooms and our hospitals. That's important for everyone to understand. I know people are anxious. I know people are eager, but patience will help us keep the number of our hospitalized patients to a minimum. We know COVID-19 is here, and as we open up more activity, cases will continue to rise. They will continue to increase. But it's the measures that we put into place that are so important to making sure that our healthcare system has the increased capacity to respond. As I have said numerous times, and you're probably tired of hearing from me, social distancing is the best weapon we have against this disease. It's the best treatment. That means you must continue to avoid large gatherings and avoid being closer than 6 feet to other people who are not members of your own household, especially if you're not wearing a mask. And I'm going to go back to a mask and a face covering over and over again because it's extremely important to helping us continue to suppress the spread and eliminate the spread of COVID-19. While we ask folks to stay at home, I want to make something very clear to folks out there. If your home or residence becomes unsafe or becomes dangerous because of abuse or violence, you are permitted and urged to leave your home immediately and seek a safe alternate locations. If you're a victim of abuse or violence, you are permitted and encouraged to leave immediately and seek a safe alternate location. In line with federally supported, state-managed, and locally executed response and recovery plans, county governments are empowered to tailor specific restrictions on businesses and public life as long as those restrictions do not go below the standards the state has issued and I have read. For example, I said you can have 50% capacity in a restaurant. If a particular county wants to say you can only have 25% or 33%, they're welcome to do that. If they want to say we don't want to open up nail salons, they can do that. If they want to say that we don't want to open up some retail establishments, they can do that. They can just not do anything that is not at a minimum what has been set forth previously. Businesses in counties are also empowered, as I just previously said, to impose stricter distancing standards or requirements that they feel are necessary. And I encourage these businesses to communicate standards appropriately to their customers. Some businesses have communicated they do not want to open under these plans. And I fully understand that, and they are not obligated to open under these requirements. And if they want to say we have a 10-foot separation, they're entitled to do that. If they want to say we're only going to allow one person in the barbershop at a time, they're allowed to do that. They are allowed to make their own decisions, either the business or the county that we're dealing with. I'm encouraging all Nevadans to stay vigilant and protect themselves against the virus and prevent a surge in new cases, and so we can stay safe and stay open. Our actions will now determine what actions we can take in the future. It's our personal responsibility, each and every one of us, to stay safe for ourselves, for our loved ones, for others, and to work together through this process. One individual that does not follow these guidelines can make an enormous difference in the number of positive cases that we get. And they're spreading it because they're asymptomatic and don't even realize it. And they might not care about their own health, but I don't want them to take it home to mom or dad or grandma or grandpa or the next door neighbor. I'd mentioned previously that we need 2 or 3 weeks for this phase to meld in order to evaluate the impact of our initial reopening. The directive I'm signing will expire on May 30th, but before that time, I will communicate with you as to how we're doing and whether we will be ready to move into phase 2 sooner, or whether or not we won't be able to move into phase 2 on May 30th, or whether or not we need to reevaluate the position that we're in. And I want to make clear, if we see a problem with any of these initiatives that I brought forth, these openings, and we can identify the activity that is causing the surge, we will roll back some of the openings that we have previously announced today. So it's incumbent upon each and every one of us to work together, to work as a team to protect everyone, yourselves, your families, your loved ones, and our most vulnerable population. So with that, thank you, Nevada, for working so hard to get us to where we're at today. Thank you for allowing me to begin reopening and get some of your normalities back. And please continue to work with me and practice good hygiene, good social distancing, good group sizes, and we can move further along. So thank you all very much, and I'd be happy to take a couple questions.